Okay, bye bye.
Okay, thank you so much, Dr. Prasad. And the next session is Botox injection. The speaker is Dr. Matt Maipaset. Dr. Matt have many techniques of the botulinum toxin. Today we have 3 cases. Okay, let's go to the next room. Thank you.
ไม่เกี่ยว ไม่เห็นอยู่แล้ว เอาเหรอ งั้นรับหน้าหมอตรงนี้ดีกว่า
Medicine from College of Integrative Medicine, Chukit Bandit University. So now we will welcome อาจารย์มาศครับอาจารย์เชิญเรียนเชิญครับ
Good afternoon, everyone. And today I will demonstrate how to do botulinum toxin. But because of the international conference, I want to demonstrate simple botulinum toxin, just as for the Corpus or Gabella or the what is it? Forehead line. But I will do the other part that FDA are not approved for improve the wrinkle, but we can find in most of the patients if you have a problem like this. As the previous session before about the lip surgery, you can know that muscle contraction may be an important role or important factor of the abnormal smiling of the patient. Just as for this patient, can you smile? ขอกล้องหน้าอันนี้กล้องหนึ่งกล้องหน้าโอเคยิ้มที่กล้องนี้นะคะยิ้มเลยค่ะ Okay. And when you look at the patient, you can see that she has a symmetry of smiling. So how can we solve this problem? We can solve the problem like this with the botulinum toxins. Okay. But how to do this? When you want to solve this problem, you must know six factors about this that I will explain each factor. Number one, you must know that the cause of the problem are on the muscle origin. Just as you know that corset or forehead line or gabella line come from muscle origin. But some wrinkles, such as tear through, such as nasolabial fold, maybe are not caused by muscle origins. So, but in some cases, as look like this, you can see that the patient has tear through, the patient have nasolabial fold. When she's smiling, okay, you can see that not only the volume loss of the nasolabial, but also the muscle overcontractions that can lead to nasolabial fold. Why I know? Because that the nasolabial fold will have increase the big problem when she's smiling. You can compare that when she not smile, the nasolabial fold is not too much. But when she smile too much, you can see that the more the place of the nasolabial fold. So that why อันนี้หมายถึงให้คนไข้ใช่ไหมคะโอเคคนไข้อยู่ต้องหันหน้าเข้าหานี่หนูเป็นนางเอกนะคะยิ้มอย่างนี้อย่างเดียวนะคะโอเคค่ะโอเค When she's smiling, yes, that's right. You can see that the more problem of the nasolabial fold. So you must know that this problem come from the muscle origin. And second, you must know that which muscle can lead to this problem. So for the perioral regions, จับที่อันนี้นะครับ for the perioral problem. So for the perioral regions, จับที่อันนี้นะครับ for the perioral region, you must know that there is a complex of the muscle. That's why the FDA are not recommend botulinum toxin in this area because you must do it with refined management. Because if you do it in the lab, in a lab, or you are not precisely to injection, what will happen? It will go to the other muscle, and it will lead to asymmetrical. It make it more seriously problem. That's why. So you must know that which muscle cause this problem. So the muscle of the oral regions are divided into two groups: the elevated group and the depressed group. Okay, for the elevated group, you can see that this one, and this one. This is the levator rabii superioris alagenesi and levator rabii superioris. Okay, and psychometricus major and minor. Okay, so sorry ขอปากกาขอ pointer อันหนึ่งได้ไหมคะอะไรที่ชี้ก็ได้ค่ะโอเค Okay, I will show you here. This is the levator rabii superioris alagenesi, and this is the psychometric major. This is psychometric minor, and this is the levator rabii superioris is under this. Okay, so when you know that the major the muscle that lead to the problem, which one? For the one that have the problem like this, นี่จริงนะคะมองกล้องนะคะ Okay, this is because the levator muscle is overactivity. We can inject the botulinum toxin all of this muscle? No. Why? Because you must know that it's just over contraction, so that's why we just relax some muscle because I must have contraction. Because if you paralyze all the muscles, the patient cannot smile and it's abnormal. Okay, so in this part, we just relax only this muscle is enough. Levator LLSAN, levator rabii superioris alagenesi. Alagenesi means the part of the muscle that near to the nose. Okay, but when you inject this muscle, what happens? You can see that is nearby muscle is composed of this one. So when you inject and not precisely, what will happen? The toxin will diffuse to the other muscle, and then the patient will develop asymmetrical smiling. That's why. Okay, so number 3, you must know that the anatomy of the muscle, what is the origin and insertions, which one is origin and insertion, and the layer of the muscle is superficial, deep, or intermediate. So if you know where is it, you can point the needle superficial, deep, or intermediate. That will make it a precisely injection. And after that, you must know that the adjacent muscle, because if you don't know the adjacent muscle and you don't aware of it, what happens? It will go to the other muscle that you don't want to relax this, and it will turn into abnormal result that you don't want. Okay, and the last one, you must know about the rheology of the muscle contraction or rheology of the toxin. Most of the doctor don't know about the rheology. They think that botulinum toxin just relax or paralyze the muscle that you don't want it to contract to make more contraction. Just as for the COVID, okay, you know that orbicularis oculi overcontraction that lead to the skin wrinkle look like this, look like the COVID. So you just inject here is enough? No, because you must know that the muscle are long, it's too long. This too long muscle, this too long. When you inject the botulinum toxin in which area, those area will paralyze. That's it. But the other area are not. When the other area are not paralyzed, what will happen? You try to control to contract the muscle. It's not paralyzed all the muscle, but it's paralyzed in some area. So some area will more contraction, not normally contraction. So what happens when you relax in this area will contract when the patient smiles. What happens? You can see what is the wrinkle here. The wrinkle move from here to here, or here look like this, or the other one, we use this rheology. The rheology is look like when you play the game just as the lobe. We have two lobe. What is that? We have the lobe. Okay. You pull the lobe. ขอเชือกอะไรสักเส้นหนึ่งไหมคะOkay. If you know the game of the lobe, yes, that's right. Okay. We try to pull. Okay. ดึงค่ะดึง Okay. Try to pull. Which one? Who will win? Okay. When you ดึงค่ะดึง When you contract, this area relax. When I contract, this area relax. That's why. So when we relax here, what will happen? It will contract here. But you must have the length of the muscle long enough to contract. So when this contract, it will lift the eyebrow. So we use this idea to change the shape of the muscle of the face by this rheology. So this rheology will happen when you inject at the lower area too. When you inject here, the patient sometimes have asymmetrical of the muscle, such as this smiling like this. ยิ้มอีกทีนะคะ Okay. You can see that in this patient, she has asymmetrical smiling. The angle of the angle of this area is more higher than this area. Why? Because of zygomaticus major is more contraction in this side more than this side. So if you want to make a symmetry, how to do that? Relax this muscle, but it's really difficult to do. But I will tell you that if you try to inject here, not completely, it will make it lesser contraction, so it will turn into symmetrical. But when you relax here, sometimes this area will more contraction, then the patient will come back again. The first visit, they come with this. When you inject this, they come with this. Look like this. Why? This is the rheology of the muscle contraction. So when the patient have asymmetrical like this, what will you do? You will inject here more, and you must inject the other part less. That will make two visits in one visit. That's why. Okay. So in this case, I will show you that we can inject here to relax the muscle here, and you must inject here too. You must know when you inject the calfis, and you know that this muscle, the first one, the problem come from the muscle. Yes, which muscle? Orbicularis osculi. What anatomy is very superficial, so you inject here whatever too superficial is will inject precisely to the orbicularis oculi. But for this area, if you inject too deep, what will happen? It will go into the origin of the zygomaticus minor. So what happens when you inject too deep in this area? The patient cannot smile. You can see that when someone inject the toxin, what happens? She cannot lift the angle of the mouth. He used only light only this. So they say that I don't want to smile after the botulinum toxin. Why? Because it's not to build more beautiful light. Okay. So we use the same procedure. That is the adverse effect of improper correction of the calfis. I will use in the ones that have too much contraction here to inject like this here. So we use the adverse effect of that problem to be the treatment goal of this patient. That is okay. I will show you how to do that. And in this area, okay, I will inject this in this area for the LLSAN. Okay, the location of to injection of these patients, I will inject in this area. But you know that the adjacent muscle are here. here, and we don't want to inject here. So how we inject in this area without involve the other muscle to prevent the adverse event after that. Okay, so you must know that the alignment of the muscle are look like this. So I will pinpoint the needle like this and go to the ear and inject and turn down here. Okay, so the dose of the toxin will at this area and won't go around to this. Don't inject here and push. It will diffuse to this area, and the adverse event will happen. That's it. It's really easy if you understand what happened. Okay, and in this patient too, psychomaticus major, we must inject at the origin here. Okay, on the tip of the sarcoma here and here. So we just inject here. Look like you inject the corpus in the wrong way. But we will do the for this patient because he has asymmetrical of the spine. And also we will inject here, but this is full dose and this is less than half dose compared with this. Okay, and this is enough. Okay, I will show how much. And the number 6. Okay, first I will remind again. Okay, first you must know that the problem comes from the muscle. Which muscle? Anatomy, origin, insertions, and superficial or deep, and adjacent muscle that you don't want to you must prevent the adverse event. And number 5, rheology of the muscle, that we don't inject only the abnormal side, but the other side is the normal side too, because it will over contraction. And number 6, the dosage of the muscle. It depends on the size of the muscle. So most of the size here is very too small. So you don't use, it's no need to use too much doses of the toxin, look like the masseter. Okay, so I recommend that in each area is about 2 units is enough. Okay, so in some case, in this case, we use 2 and 2 is total 4. So in this case, we can use 3 and 1. That's it. It depends on your imagination. That's how much it is. It looks like when you are a chef. You do if you are a master chef, you do not need to measure all of the ingredients. 2 spoons, 1 spoon. No, you just okay, it look good. That's it. Okay, so try to do this. But in the one that just start, you can use this. Okay, 2, okay, 2.5, 1.5. That's it. Okay, so I will show you. Okay, ขอเข็มขอ0.05 okay ขอกล่องก่อนนะ I recommend you to use the botulinum toxin in this brand. Why? Because of, you must know that the lower part of the face need too little doses of the toxin, and it means that it won't last long. It's about 3 to 4 months is enough. It's not look like 6 months or 1 year. Look like the upper part that we use too much dose. But when you use too small dose, is the half-life is not too much. You must have multiple injections. That if you use the other product that you know that there's a lot of unwanted protein, it will develop antibody. And when the one have antibody, what will happen? They will fail after the botulinum toxin. As we know nowadays that most of the patients face this problem, especially medical doctor. Most of the medical doctors have multiple injections of the toxin in the past because we don't have the product look like this. So most the patients that have resistant or develop antibody, most of them are medical doctors. So in this case, in this brand, thiomin have little or less of the unwanted protein. So we can use it even though the one that have an antibody is won't develop more antibodies. Okay, so and the trick to inject the case look like this is depends on the preparation. I will show you พอ 0.05 0.0 no 0.05 กับ 1.0 โอเค 1.0 แล้วก็เอา1เอา 2.0 0.2 โอเค and okay I will show you that this is the preparation. Okay, for the Xeomin, but each bottle we have 100 units. We will dilute with normal saline about 2.5 cc. 2.5 cc. So it look like Botox, the same. If you familiar with the Botox, so 0.05 cc equal 2 units. So it's enough for 1 point, as I said. Okay. So most of the doctor that I know prepare the toxin too much for one saline for one treatment. I won't agree with that. Why? Because it's difficult to inject here and look at here and okay stop not only this and go to no. I always use one preparation for one area. Okay, you can use many styling for one treatment. It's okay. It's look it's not it's look professional more than the other one. That's it. Okay, so in this case, I prepare for 0.1 for this area. Okay, I inject 0.0 half of this and half of this in it and throw to the bin. That's it. Okay. And in some case, if you want to precise, you can separate to each area. So you want concern to count it and why the injection that you must precise in the injection. That's it. Okay. นอนตรงนี้เลยครับเรายกเตียงขึ้นได้ไหมมันจะมองตรงนี้เห็นไหมอ๋อไม่ต้องกระตัดอันนี้เขาเอามานี่เลยเอาเก็บนี่เลย Okay. The first area I will inject here for the levator labii superioris aragonesi. Okay. So I prepare for 0.1 and I will inject half in this area and half in this area. So you see that we inject here at the angle of the nose, and we put the needle go to up to this, and I push here. I push the saline to touch the muscle, and I try to inject slowly here, slowly, and go downward here. That's it. It's enough, and I know that the solution of the toxin are confined in this area. It won't diffuse to this area. Most of the doctor inject here, they do like this and push. What happened? The toxin will diffuse to this area and asymmetrical will happen. Okay, and the same as this area. Okay, you see that? You see the direction of the saline not look like this, but it's parallel to the muscle. It's very easy if you understand the anatomy of the muscle here. If you want here and here, that's it. Enough, finish. Okay, and after that, I want our 0.1 them. Pardon? Yes, to the muscle there. ขอไปเอารูปมานี่มา As I said that number 3, you must know that the origin and the anatomy of the muscle, origin and insertions, and the level. Okay, this part is very superficial. It's not too much superficial, but it's not superficial. You see that that's only the subcutaneous is enough. Okay, เก็บไว้เลย Okay, and for this area, as I said that he has too much contraction of the psychometric measure. So I will inject here. I think that 2.5 and 1.5. Okay, so total is 0.1 is equal to 4 units. And I want 2 here and 2 here, but it's asymmetrical. So 2.5 at least 1.5 or 3 to 1. Okay, to this area. It depends on the size of the patient, the size of the muscle, and the asymmetrical of the muscle. Here. Okay. You touch the bone, the tip of the zygoma, and you go straight here is perpendicular because it's too deep. The origin of the zygomatic measure is too deep. It's near the bone. That is. So you see that? กล้องเห็นไหมตรงนี้ Okay. This is half. This is half. Okay. I want more. A little like this. Enough. And the rest go to this. So this is why the preparation tell me how to titrate the dose. It depends on the muscle that you think that the problem of the muscle. Here, tip of the zygoma and goes perpendicular to the bone and inject here in the enough. Okay. And the next patient, ขอคนไข้คนต่อไปเลยครับ If you understand this, you can apply to the other muscle. เสร็จแล้วค่ะไปเช็ดหน่อยนะคะฝากใช้เช็ดตัวหนึ่ง You can apply ใครนะ2515คนที่2เลยค่ะโอเคเอาด้วยค่ะมายังคะคลีนเลยค่ะคนที่3คลีนยาเลยยังไม่เดี๋ยวหมดเวลาแล้วโอเคเอาทิชชู่เอาอะไรเช็ดมันต้องโอเคนั่งเลยค่ะนั่งเลยเอาผ้าหันหน้าเข้าหากล้องหันหน้าเข้าหากล้องนอนบนเตียงสิคะโอเคมาอันนี้เลยไปฟังกันเช็ดคนละข้างเช็ดเลยค่ะ In this patient, you will see that what will happen to the patients, and I will let her to smile, and you notice what happened of the problem of the patients. เดี๋ยวยิ้มนะคะโอเคกล้องไหนนะคนไข้คะเอาต่อกล้องกลางค่ะกล้องกลางโอเคยิ้มสิคะยิ้มโอเคยิ้มโอเค You see what happened, and you must know what are the problem of the patients นะครับไปได้ไหมยิ้มอีกทีหนึ่งนะคะ Okay, you can see that there's a lot of problems. Okay, first, she has asymmetry at the lower part of the lip, not upper part, because when we analyze the patient, you must analyze look like this, smiling. Okay, you can see that asymmetrical, but in this area are more contraction than this. A little bit, but it look like the same, no seriously. But asymmetry come from the lower part. Okay, you can see that. What happened to this patient? The deep pressure muscle, the deep pressure muscle. Okay, ให้เห็นหน้าคนไข้อยู่ในเฟรมด้วยนะคะ the deep pressure muscle composed of two major muscle. That is DAO down, DAO deep pressure angularis, DAO deep pressure angularis, and DLI deep pressure labii inferioris. And think about what happened to this patient. Which muscle? This one, DAO or DLI? What do you think? DAO or DLI? Which one? Which one? You think down? Look at the patient and look at the muscle. You think down? What happened with down? When down contraction, DAO contraction, it will lead to marionette line. Look like the patient also have the marionette line, but the patient asymmetry here. What do you think that which muscle is over contraction? Which one? DLI is come from DLI. DLI will replace the labia. The labia. The DO is just only anguli. Okay, anguli is the meridian line. Okay, but the DLI will go look like this. Some Miss Universe Thailand, one of the Miss Universe Thailand have the problem like this. Go back to look at the cloudy moment. She's smiling, look like this. Okay, and she still be the one that's really beautiful. But someone have asymmetrical because of this. They think that this is asymmetrical, but contraction of the muscle is happened since her childhood, but it's not too much. But when she grow up, the muscle more contraction, the problem will prominent. Okay, and in this patient, it's very difficult in this area. Okay, I will show you how to relax this muscle. Okay, for the DAO, you should not inject all of the DAO. Why? Because you know that ขอมาที่ตรงนี้นะครับ Okay, because when you inject here, you don't know it will go to the adjacent DLI. So what happened when you inject here and too deep to the DLI? The patient will have asymmetrical like this. Before injection, they don't have the problem, but after injection, when you inject in this area. So for the DAO, if the patient have the problem about DAO, that is malarial line, you just inject in this line is enough. Don't go to this, okay, because it will go to the adjacent muscle that we don't want, okay. But for the one that have DLI, so how we can inject it, okay? You can inject here, but you must aware. What you do aware? The adjacent muscle is very important here. That is orbicularis oculi. What is the muscle action of orbicularis oculi? To do like this, okay? Do the Starbucks, do like this. ไหนฮะอะไรนะคะ Okay. So when you inject here and the positions go to the orbicularis oculi, what happened? They cannot do like this. Oh, they cannot drink the water with the straw. That is okay. So you must know why is the orbicularis oculi is about 1 centimeter, not over than this. So we will inject here, but 1 centimeter below the lip line, okay, and not go to this because it will go to the DAO. Okay, so the area, the safety zone is only if you want to collect the DLI. So what will I do? In this area is over contraction and this is normal contraction. But we don't inject only the abnormal injection. As I said that the rheology of the muscle, after that the patient will come back with this over contraction. Okay, so in this case, in this case, we will inject here 1 or 2 here. Okay, 1 or 2 here and here. Okay, and this is half dose of this. Okay, so the location is in this area of the DLI. Okay, and 1 centimeter below the lip line, and not go to the DAO. Look like this. Okay, and 2 units, maybe 2.5, and maybe 1, 3, or 1, or 2.5, or 1.5. It depends on the severity of the muscle. In this case, I will use in this area 3 and this 1 because I think that is too much. Okay, ขอ 0.1. Okay, I prepare for 0.1. It's the same. So I will inject half and a half of the half and the rest here. That's it. Okay, I maybe divided into 2 doses. Is depend and the total dose is 0.75. That's it. Okay, not only. Okay. Hết cần này. Okay, yeah. You see that? It's just superficial, not too much, not too deep. Okay, 1 centimeter and above the line of the DAO here. Here, look like this, and here look like this. Okay, okay, it's enough. And the rest here, I will divide into two point of injection two. That is enough. Okay. And if the one have the DAO problem, in this case, the angle of the mouth will go down. Okay, such as one actress of the Thai drama last year very popular about this muscle. Bukhe Sandiwad. When she has smiling, look like what is it? The other actors one. Suwachani, Gig Suwachani, yes, that's right. There is a major DAO problem. So how to solve the problem? So someone you shouldn't inject here because she will not popular again, right? Okay, she must use this muscle. But for the one that have the aging problem about the mouth, okay, the mouth corner, before you injection with the filler, to inject the lip, inject the malleus line, but it will disappear very quickly when you have the muscle problem. So you must relax the muscle in this muscle too. So as I said that เอาเวลานั้นก็ให้เห็นหน้าเห็นกล้ามเนื้อถือด้วยครับ As I said that for the DAO problem ให้เห็นคู่กันเลยค่ะใกล้ๆก่อนอย่าไกลมากไปซูมเลยค่ะซูมค่ะซูมตัดหน่อยค่ะช่างตัดจะหลับค่ะ ห้องตัดกำลังหลับจริงๆเพราะพูดว่าหลับก็ยังไม่รู้สึกตัว โอเคโอเค when you inject here you must know that we inject only this line only this line not too much of the DAO okay so the alignment you should line the Marian line that is the lateral border of the DAO okay and we will divide into three parts. We will divide it into three parts, okay? And we want to relax only this part. We don't want to relax here and here because this is too much for the to close to the obliquus oris. And this area we can inject here, but I don't want. I just inject here is enough. So ขอ 0.1 ครับ So how we inject in the middle part, you will see that I prepare for 0.1 is 4 units. Okay, half of it is 2 units. I will make the injection here is between the lower part and middle part here, and my tip of the needle go to the middle part, and I inject here and withdraw like this. It will total the muscle. That's it. It's really easy. Okay, so the same called V-sorting. I will do it again. Okay. We mark the lateral, the line of the mallet bar in the lateral part of the DAO, and we divide it into three parts symmetrically, and the injection here between the lower third and middle third and parallel to the line and to superficial, and you see that the needle is parallel to the skin, and inject here and with slowly. Okay, it will total the dot. It's enough because in this case she doesn't have too much and equally, so I divided the dose equal. It's not look like this. Okay, so in this case, it's really common. It's not uncommon problem if you notice the patient like this. Okay, เสร็จแล้วค่ะ case 3 เชิญเลยค่ะ and the next one, what will happen to these patients? Okay. อะไรนะ That was some doctor want to inject here, but I think that it's not enough. It's not necessary. Yes, that's right. So if you want, but you know that I inject in the center of the muscle, it will paralyze. Even I think that if you inject here and here is equal, no need to inject here. But if you want, it's okay. But don't inject at the upper part because it will paralyze the auricular cellular. Okay. And okay ลองนั่งนะคะ Okay ยิ้มสิคะ Okay เงยหน้าอย่าก้มหน้า Okay. In this case, she says that she has asymmetry of the face. You see? And when I met her this morning, what happened? The nurse aide tried to do anesthesia here because they think that it comes from the masseter. But you know that asymmetry of the face are not come from the masseter. It comes from the oral muscle, perioral muscle. So as I said, that you must evaluate that the problem come from the muscle first. Is come from the muscle? Is it come from the muscle? Yes, asymmetry come from the muscle because when she does smile, it looks symmetry. But when she's smiling, it's asymmetry occur. But number two, which muscle is not come from the masseter. So no need to inject the masseter. If you want, it's okay. But if you inject the masseter, the asymmetry will still happen because you access the wrong muscle. So which muscle that make it asymmetry? Okay. You can see that the same like the other one. You work in the same hospital. I don't know that something why most of the nurse here have asymmetrical face. I don't know why because a lot of the patients of the nurses here have asymmetrical face. And the same problem too. I don't know why. Okay, so and look at here. So psychometric cast measure is too much contraction, right? Okay, and here you see that LSAN is too much contraction, so it make it look like this. Okay, so okay, that is enough. It's enough. It look like the first patient. It's the same. Okay, I will use the same dose here because the same problem, but I will inject 75% here and 25% here. Okay, it's the same. And no need to inject the masseter. Okay, นอนเลยค่ะ ขอ 0.1 อันค่ะ The same, I will repeat it again. And 0.1 อันเดียว เอามี 2 อันไหม เอา 0.05 0.05 มี 2 อันใช่ไหมโอเคมานี้เลยโอเค ขอแอลกอฮอล์หน่อย Okay, the nurse says prepare for 0.5. 0.05 is 2 units here, so I will check here for this. Again, I will show you that here, like this, and inject and withdraw. Okay, อีกอันหนึ่งครับ Okay. Here, did you see that we inject too much strength here. We push the side link, okay, to make the needle hit the muscle and inject and withdraw. Yes, okay. เอา 0.1 นะครับ Okay, and I will inject here at the tip of the zygoma, but not parallel to the skin, but perpendicular to the bone, like this. And 75% here, okay, and 25% here, tip of the bone, and intake here. It's enough, okay. But finally, we must realize that the lower part may be not only one session. You must tell the patient that asymmetry can occur again. So 3 to 5 days after injection, come to visit me and collect again because the muscle may be not as we imagine. So we can collect a little bit. If you understand this, you can collect if just add if Chisma is still over, we can inject more and more, but don't make it too much dose in the first visit because if it's too much, you cannot collect it again. Okay, so we use only 1 to 2 units each side is enough, and if you want more, it's just 1 unit or 2 units, and you can have the optimal correction. That's it. Okay, but sometimes I inject here too much like the first patient, and after that the patient come again that is happen in this area. I just collect a little bit here. After that, she is okay. Okay, about 1 to 2 sections is enough, not only 1 session. So tell the patient first, because if it's abnormal and she come back, she won't blame you. That's why you make it asymmetrical again. Okay, and for this ขอพี่เตี้ยเลยค่ะเสร็จแล้วค่ะ Okay, so the last one is the most beautiful one here. So when you know the difficult area of botulinum toxin injection, so the simple area is really easy. Okay, I will show you that she has a lot of cold fish here. So how to inject the cold fish professionally that differ from the simple routine injection here. Okay, so look at you now. For the one that have cold fish, what ขอประกาศหน่อยค่ะ what my guideline or what I do. I don't fix to the guideline, just add one whatever. It depends on the muscle. So one size fits all. You shouldn't use one protocol to every patient. You cannot use like that because the muscle of each patient is different. Even though the simple muscle like orbicularis oculi. Okay. ยิ้มอีกทีสิคะ Okay. ยิ้มอีกทีสิคะ You can see that in this patient. ยิ้มเต็มที่เลยยิ้มเต็มที่ This patient orbicularis oculi in the lower part more contraction than the upper part. But some patients, the upper part more contraction than the lower part. But some patients have middle part more than the upper and lower part. So it's different. So you cannot use one protocol for the cold fish. You can adjust depends on the muscle of the patient. Okay. So what I do, okay, I want the first one. You must know that in this area, even though it's very easy and most common injection of the toxin, but most of the patient, most of the doctor don't know it too much about this area because they think that it's really simple, but it's not. Okay. First of all, you must palpate the orbit, the orbital rim first. Why? Because you must inject far from the orbital rim about 1 centimeter. Why? This is really important because if you inject too near to the orbital rim, the toxin can diffuse in the eyeball. What happens is you go to the intraocular muscle, lateral rectus. So the patient will come that, the doctor, when I look at this, it's okay. When I go to this, it look like diplopia. That's it. Okay, so it happened with the elderly patient. Why? Because the bone resorption go to the lateral. So you inject here, but in young patients, orbital rim here, in order here. So it's near to the protocol of you, and you don't know it. Okay, so touch the orbital rim first. So you inject wherever that's far from 1 centimeter of the orbital rim is really safety. Okay, it's only that. For this area, we will divide it into 3 parts. Middle part, upper and lower part. Okay, you can adjust the dose depends on the strength of the muscle. If the muscle part too much, I divided the dose to here more than here. And if the central too much, I divide here, and if I divide here. But you must remember that the lower part don't go too deep to the bone. Why? Because if you go to the zygomatic major and minor, if the patient doesn't have abnormal contraction, you don't do like that. So in this area, you must superficially, too much superficially, don't perpendicular, don't do like this. It's different from the previous patient. I will do just superficially and pinpoint the detail into the eye. Don't worry about the interocular muscle because it's far from 1 centimeter from the orbital limb. That's it. Okay. And initially, it's very free. It's very relaxed. You can inject whatever you want because you don't worry about the adjacent muscle. But in this area, you must know that what happens if you inject if you don't understand the anatomy. It nearby to is very close to the frontalis muscle. It's very close to it. Look like wife and husband. It's very close. You understand that? When you inject too deep, it will go to the frontalis. And what happens? The frontalis lift the eye, the tail of the eyebrow. When it's relaxed, the tail of the eyebrow down. And most of the aging patients have the eyebrow down, and you make it more seriously. So you just touch superficial or little dose is enough. And if you want to make it relax, you may be inject here higher than the eyebrow. When you inject the frontalis higher than the eyebrow, about 2.5 or 1 inch of the distance, okay, it will save zone that the length of the muscle have the contraction enough to lift the eyebrow. That's most of the elderly patients want to lift the eyebrow. So the trick, you must inject in this area 2.5, more than 2.5, okay, or 1 inch. Someone said that about 4 centimeter, because if too far from the eyebrow, too much contraction, the length of the muscle have enough to contract to lift the eyebrow. So, and when you inject here, too superficially, too small dose to inject the orbicularis oculi, and don't make it go deep to the frontalis. It's really close. That's it. Okay, I will show you how to do this. 0.2 ครับ And for the eyebrow, I prepare for 0.2 is enough. It's about 248 units is enough. Some patients have too much. I prepare for 0.25. That is 10 units. Okay. In this case, okay, the line here. So I inject here. Is about 2 units here, 2 units here. Okay. 2 units here. You see that? Very little. Very little. I divided 2 units into here. It's just superficial, and I think that it won't go to the frontalis. That's it. Okay, you can inject whatever, like this. Okay, and I have 4 units here for the lower part because the lower contraction is too much. Okay, so I inject here. You see, superficial and pinpoint here, not go perpendicular, not go to this, and we can divide this very small dose that is we won't diffuse to the other area. Look like this, you know. So the pattern of the wrinkle injection here is different. It depends on the muscle, and you will make it look more naturally. Most of the patient inject the bottle and look not natural because you don't evaluate the muscle of the patient first, and you don't have the plan of the injection. So it's look unnatural. Okay, finish. เวลาหมดยัง Do you have any question? I finished.
Finished. Very, very great lecture and great demonstration today. And Professor just.
Okay. For the small line, I think that in the inner part, middle part, okay, you can use dermotoxin. It means that you dilute it. Okay, we use 0.05 is 2 units, and we draw the normal saline into 0.2, and you inject superficial, only the intradermal all over here, and the total dose is just 2 units. Okay, that is enough. Okay.
So it's dilution that you're talking about. So for the lower face, so can you give us some pitfalls that we?
Yes, first one,
Yes.
as I said, that 6 points that you must evaluate. The first one, the problems come from the muscle or not. If yes, which muscle? Which muscle is really important as I evaluate the second patient, okay? And number 3, when you know that muscle, what anatomy, origin, insertions, and the plane, superficial or deep, that you can know that you can pinpoint the needle superficial, deep, or mid intermediate, okay? And number 4, adjacent muscle that you don't want it to diffuse to that, okay? And number 5, rheology. Rheology, that when you relax muscle, the other muscle contract, that's it, okay? And number 6, the size of the muscle that will lead to the need of the units of the muscle. That is 6 point to manage the muscle contraction with botulinum toxin.
Oh, 6 points.
And the most important, that is, you must use the right brand, because if you use the one that have too much protein, it will develop antibody in the future.
Hey, that's not a great point. We need the branded one. Very, very good. So thank you very much, Professor Mat. So to give us the demonstration today, and we will move to the other session นะครับ
Okay, thank you so much for Dr. Mas for reminding us to remember the muscle of the face. Okay, the next session is very interesting case, the filler injection for optimal feminine. Dr. Ekalak Thomas Sunthor. Dr. Ekalak is the present work at Epic Medical Center. He has a 10 years experience in medical, aesthetic, and aesthetic surgery. Okay, see you in the next session. Okay. Before go to the Dr. Ekalak's room, we will Asan. Okay.
Okay นะแต่ครับเดี๋ยวขออนุญาตหมดกล้องครับนะสวัสดีครับแต่ครับมันติดนะครับต้นนี้ครับ
Okay, we go to Dr. Ekalak's room, please.